Welcome to the Mind Body Temple podcast, your healing space with Dr. Rod. The purpose of this podcast is to bring hope to patients with chronic pain, anxiety, and depression. Today, I want to talk to you about fibromyalgia. Fibromyalgia is a condition of exclusion. What we mean by a condition of exclusion is that we have to rule out many other diagnoses in order to reach to the point that this is the condition we are dealing with. Fibromyalgia is a condition that many doctors do not understand well and many patients suffer with. Unfortunately, when patients with fibromyalgia go to doctors, many times they are called that you are imagining the pain or it's all in your head, which is somehow true because we perceive the pain with our head, with our brain, but it doesn't mean that there is no physiological condition behind it. Fibromyalgia is presented by chronic widespread body pain. It means that the pain is not related to or limited to only one area of the body. It can be distributed wide around the body from head to toe, and it's usually mixed with other presentations like fatigue or brain fog that is called fibrofog, some weakness and difficulty with concentration, and it can be also linked with other conditions like anxiety or depression. The physiology of fibromyalgia is much of a dysfunction of central nervous system. You see, when we perceive the world around us or the body, all the signals of sensory system or pain comes to our spinal cord, and from spinal cord they go to our brain. It's within this central nervous system that we understand and make sense of the signals that are coming to our brain. And through this passage, there are many gates that the signals have to pass through. They go through posterior part of our spinal cord and with a pathway that goes up to our brain that we call them ascending pathway. They reach the center of our brain, which keeps our emotional memories, and then they're projected to the somatosensory part of our brain. It's through this passage that the signal has to go through numerous gates, and if these gates are closed, the passage is slower. If these gates are open, the passage will be faster. Once it reaches the somatosensory part of our cortex of our brain, then there are signals that go down. It's called descending pathway. That the purpose of this pathway is to stop the signals to keep coming. The brain finds out there is a pain signal and then, says, okay, stop sending me signals. The problem is that in this chronic condition, there is oversensitization of the central nervous system. What it means is that the gates that normally should stop the passage of pain signal to brain or slow down the passage, they become wide open, and the gateways become open, the pathways become gateways, they become highways. And the descending pathway that is supposed to stop or slow down the passage of all of these signals become dysfunctional. So basically, there is facilitation or oversensitization of our central nervous system for passage of all signals. And many of these signals are not pain signals. For touch or temperature, they can be perceived as pain signals. It's like a mix-up of signals going to the brain. And patients suffer from this because they go to the doctor, they check, okay, where is the pain? They check your shoulder, they check your back, they check your head, and they say, no, there's nothing in the test. It doesn't show anything. But the patient is in real pain. And the problem is that many times they are doubted by their doctors and their family and the members of society, co-workers, because they look normal. They look not in suffering from any physical condition, but in reality they're suffering from tremendous amount of pain. They don't have enough energy. They can't sleep well. They have problem with their mood. They have difficulty to find their place as a person, as a member of family, and as a member of society. And they suffer in loneliness because nobody can understand them. It's really a terrible condition because we came up with a label with it, but we can't really do much for the treatment unless we go back to rebuilding the baseline of health. The treatment of fibromyalgia is a lifestyle treatment. We have to work on bringing up the reservoir of health, the reservoir of vital energy in order to fight the fibromyalgia. There's also practices related to how we move, exercises, but because of the fatigue, there is just a limit of how much they can do. So we have to be, budgeting the amount of energy that we use, but it's important that the movement and muscle strengthening to the limit of the energy be done. There is also importance of what we eat, because there are many food that can induce inflammation in our body, and they can make the fibromyalgia worse. So an anti-inflammatory diet, eating things that will not induce inflammation in our body, is very important. Also, it's important how we manage our stress, because increased amount of stress can augment or increase the amount of level of the perception of the pain. Why? Because, as I mentioned, the passage of all these pathway of the pain passes through the center of our brain. It's where we keep all the memories of emotional trauma or adversities. And emotional center, if it's overwhelmed by all of these signals and memories, it can increase the volume of the pain. And then the signal is sent to the somatosensory part of our brain, and that part of our brain receives signals 10 out of the 10, and it's really severe pain. And the patient is suffering from level of the pain that should not be normally suffering from. So managing the stress, doing mindfulness, meditation, are very important. But what is important is that we use the skills of mindfulness and meditation and mix them with compassion and message of safety. Because the brain would understand the signal of pain as a signal of danger. And we need to add the component of safety, message of safety. When you bring your awareness to the sensations of your breathing, then add to I am safe to it. Because with that, you can gradually rewire the brain from the danger mode to the safety mode. And add compassion. Talk to yourself, talk to your brain the way you would talk to a loved one. Respect yourself the way you would respect somebody that you really and truly love. And through that way, you will bring some level of safety and decrease the pressure of the emotional adversity into the center of your brain that would gradually bring down the volume of the pain. It's important that you move, but it's important that you don't overdo and be mindful of the amount of energy that you have. Because if you do too much, you will go through exhaustion, and that would bring down your emotional state and will make your energy for following up of your treatment worse. Basically, you feel disappointed because you overwhelm yourself. It's like a monetary budget. You have to budget amount of energy that you have and then use it wisely. But it's important that you do move, you do stay active in order to keep the muscle strength and in order to bring more energy to your future activities related to treatment of fibromyalgia. Also, pain patients suffer alone because their family members, because their co-workers, their doctors even may not understand them. They suffer alone. So it's important that we be mindful about it. I'm a pain patient myself, that's why I say we have to be mindful about the importance of connecting to others. Don't be ashamed to talk about your pain, and don't be ashamed to express your condition to others. They will be sympathetic to you if you tell them how you feel. Sometimes we fear telling them, and we'll keep telling them, will make them tired. They'll be tired of hearing all the time how we are in pain all the time. But in reality, if you tell them, they'll have better understanding. And when you stop telling them, when you stop talking to others, when you stop connecting to others, you can even connect to other patients with pain. You can connect to other people with the same condition, and then go to the patient forums, go to associations or patient support groups with fibromyalgia and connect to them. And this way you find peer support. You find that you're not alone. There are other people that suffer from the same similar conditions. And this way you can connect and have a society, have a community. And then you realize that you're not alone. There are others suffering from the same condition. You can encourage them and you can find courage from them. But you come out of isolation. Isolation is not good for us. It's not based on our gene to be alone. Our gene forms our life form in a way that we have to be with others. So don't be ashamed. Talk about your condition. Find support through peers, through doctors, through society, and come out of this prison of loneliness, because that will make your condition worse. When we talk about it, we have to talk with compassion. We have to talk about it with understanding. The way you would guide, support, and accept a loved one with a problem, you have to talk to yourself about your pain condition and give yourself guidance, give yourself support. So move well, think well, catch the negative thoughts and challenge the negative thoughts and change them to positive thoughts. Eat food that is not inflammatory food. Move, try to have some level of muscle strengthening. Stress management is important. Connect to others. And then there are some vitamins that you can use, and the omega-3 is important. There are some medications that are helpful. You can use medication that will calm down the membranes of the cells of nervous system that we call the membrane stabilizers, things like gabapentin or pregabalin. Your doctor can talk to you about them. Or there are some antidepressants. You don't use them for depression, but it will help the depression if there is an element of depression there. But that things like duloxetine can help also the fibromyalgia, and it's approved for fibromyalgia in Canada. Combination of these solutions can be helpful, but above all, you need to know that there is hope. Hope is the basic element of life, and when you know that there is hope and you know that there are others that are suffering from this condition, be courageous, go out and talk to them and seek help, because there is hope and there is help. I'll talk to you next time about other solutions that you can find for chronic pain. Thank you for your time.